Yeah, so for really any tendinopathies, muscular strains, laser is a really good modality that we use here in the office.
Hey everybody, it's Bella here with Dr. Brady at Kalkstein Chiropractic, your Towson area chiropractor. And today I'm going to be helping Brady out with some forearm pain by lasering his medial epicondylitis.
Yep. And just been playing a lot of volleyball here recently. I actually have a 12 tournament here next week, so appreciate any help that you might be able to give me here today, Bella.
So for the laser, unfortunately it can get very hot, so you have to keep it moving. And Dr. Brady, what does it feel like?
Yeah, it just feels like a warm, like heated massage, basically, is the best way I can describe it. Yeah, as you can see, Bella's moving it constantly, just because it is creating warmth there to the area. So it's a nice modality. It feels very relaxing while producing a lot of benefits.
Yeah.
So right now Bella's near the attachment site for the wrist flexors. And in volleyball, other like racquetball, tennis, these epicondylitis injuries can be very common in those types of sports. So what's the laser doing here, Bella?
The laser is red light therapy, and it's going into the muscles and into the tissues to help decrease that inflammation and decrease the pain that he's having. It's also to help reproduce cell regeneration?
Yeah.
Or help produce.
Promote cellular regeneration. You did good. Yep.
Close enough.
And then while we're at it, we can figure out.
Good.
This is the hard part.
Yeah, so for really any tendinopathies, muscular strains, laser is a really good modality that we use here in the office. Get me all prepped.
All prepped and ready.
I appreciate it, Bella.
You're welcome.
Thank you so much. If you guys have any questions about laser therapy or any other modalities or treatments we do here in the office, comment below, and our videographer, Carly, will hit you up. Thanks, guys, for watching.